At its basic level, the technique is a way of removing a skin cancer and checking the margin under a microscope to ensure that you've removed all of that skin cancer from the skin. At its most basic level, Mohs surgery is a technique for removing a skin cancer, usually basal cell or squamous cell cancer. And the technique is actually named after the doctor who developed it. Dr. Frederick Mohs developed it at the University of Wisconsin in the late 1930s. The technique with the highest cure rate for skin cancer. And the reason for that is that you are checking 100% of the margin under a microscope. A traditional excision only looks at about 5% of the true margin of a specimen when you cut it out. Well, I think first of all, patients always want to know, what is this technique about? And I think a big question is whether or not they'll be under general anesthesia or need to be, put out for the procedure, and which the answer is no. It can all be done locally while they're awake, and many patients sit there and have a coffee and a snack while they're waiting for the tissue to be processed. The technique actually is a tissue-sparing technique, so it actually takes out less tissue than in a traditional excision, which leads to better cosmetic outcome. Patients should expect to spend at least half of the day for the procedure. And the reason for that is really, the tissue processing that occurs. After the tissue is removed, it must go to a lab, it has to be processed, and then the slides have to be looked at by the physician performing the procedure. We always tell patients that, looking at a skin cancer on the surface is not the same as doing Mohs surgery and looking under the microscope. So some skin cancers have roots, and the final defect after we remove the skin cancer may be bigger than what we expect. But needless to say, no matter what the size of the defect is, getting the best functional and cosmetic, repair after that is of utmost importance to us. The Mohs technique is a tissue-sparing technique. We're really only removing skin cancer, and we're leaving as much normal skin behind as possible. And that ensures us to give us the smallest possible scar after removing the skin cancer.